If you want to be an entrepreneur, you really do. I think you do best if you don't really require that external validation, right? It's just something where it's like the Wild West, and we're on the Oregon Trail, and you have to forge your own path sometimes.
Yeah.
But I think that's the fun of it. That's like the
Yeah.
part where creative people like you and I want to do something different and want to explore a little bit and what else we can do to make the world a better place.
Welcome, everybody, to another episode of the Business of Better podcast. And I'm your host, Dr. John Chuback. And today we have a very special guest, my dear friend and colleague, Dr. Carmen Fong. Dr. Fong, welcome to the Business of Better.
Thank you so much for having me. Great.
Let me give you a brief introduction, and then I'd like you to fill in the gaps because these interviews are all about our guests, so nothing to do with me. I'm just here to facilitate a good conversation and bring to our listeners information about physicians and other healthcare providers who may be interested in entrepreneurship. So Dr. Carmen Fong is a medical doctor, and she's going to correct me if I have any of this wrong. I believe she has her undergraduate degree from Sarah Lawrence College and did her medical school training at Michigan State, making her Spartan.
Yes,
and
go green.
Go green. And she then did a general surgical residency at the Icahn School of Medicine, Beth Israel, I believe, in New York.
Yep.
And then a colorectal surgical fellowship at Stony Brook, if I'm not mistaken, right?
Yep.
Great.
Yep.
And then Dr. Fong practiced colorectal surgery in the New York City area for a number of years, very successfully, and has subsequently moved on to do some very interesting things, I think, in the entrepreneurial world, and I think you'll all agree with me. So with that brief introduction, let's get right into it. Dr. Carmen Fong, welcome to the program.
No, thanks so much. I mean, Dr. Chuback, I've read your books, and I feel like I've only scratched the tip of the iceberg in terms of what all I have to do to be, stepping in your shoes.
No. It's certainly not a contest. And if it were, I'd be somewhere near the back. I'd be somewhere near the back of the pack. But I do love to discuss entrepreneurship and how we as physicians and healthcare providers can, I think, work to maximize our reach, because we have all this knowledge and we have all of these skills, and it's wonderful taking care of patients one at a time, as we both have and as we both continue to do.
Right.
So the question is, tell us a little bit in your own words about your career. I touched on some of your training in the early parts of your career, and how it's unfolded for you.
Yeah, I mean, I've been looking forward to this because I think that is one of the things we're not really taught as physicians in medical school, like how to, build a business for yourself, and how to, not really monetize your expertise, but kind of, right? That's what we're good at. That's what we spent 12 years of our lives training for. But how else can we help people? And like you said, that is always the bottom line. I'm always looking for a better way to help people. And that's why I like the name of your podcast, the Business of Better. For me, it's bettering myself, but also bettering the lives of my patients. That being said, so ways that I've explored, being an entrepreneur in the last few years. I think I always want to point to LinkedIn, because LinkedIn was huge, in kind of this process, and I did not expect that at all. So I was pregnant when we moved to Atlanta. And during that time, during my 6 months of kind of being pregnant and a few months postpartum, I decided I was going to write a book that had been on the back of my mind for about 10 years. It's called Constipation Nation, and it's really about the history and science behind constipation.
Amazing book, by the way. I have read it from cover to cover. You gave me a copy when we were at the American Venus Forum, I believe, together in Atlanta. And also one of my business partners, Chris Ticchio, has had a lot of IBS and problems over the years. It's helped him tremendously. Tell us about that, please.
Oh, that's good. No, awesome. That was the main thing, was that, over the years of working at Mount Sinai, I had been talking to, patients 20, 30 times a day about their anal rectal issues and how this is, sometimes stems from your digestive health issues. And people were always kind of astounded that this was the case. And then I realized early on in my practice that we're taught in medical school, oh, okay, hemorrhoids, constipation, tell people more fiber, more water, more exercise, but we never really say how much. We don't say, oh, 25 to 35 grams of fiber. And patients would be like, what kind of fiber? Like, is cereal good for you? Do you need soluble or non-soluble fiber? So things like that kind of led me down the rabbit hole of, looking for all this research that we aren't necessarily taught in medicine, but I love talking about cross-disciplinary knowledge, in nutrition and physiology and, endocrinology, stuff like that. So a lot of it ended up being nutritionally based, about the soluble and insoluble fibers, and all of that research ended up into this book. So it was just really a deep dive into how we can help our patients better. But it's kind of funny because I thought the book was kind of like the end all and be all, but as I've talked to people over the past couple of years, almost a year now since it's been published, it really is more of a door opener for you for other opportunities. Because once I put out there that, this is what I talk about, like butt and gut health is my entire life, I've had people like you reach out to me for partnerships for H formula, a hemorrhoidal supplement for people suffering from hemorrhoids that has, made a huge impact on my patients. So you reached out to me through LinkedIn. One of the other, actually, all three of the current opportunities I'm involved in, I think we're all through LinkedIn. So one of the other ones is Polari Group. So Polari Group is a sexual health and wellness company based in London, and right now we're launching something called A-Ball. And I was there from like the first, days of development. They wanted me to tell them all about like what the rectum does and what the current practices are for anal douching. And we talk a lot about that. And the goal is that we want to destigmatize like anal sexual health. And, this is a device that will actually help people not have to douche before intercourse anymore. So that's probably, kind of like the edgy one to start with, because the rest of them aren't about anal sexual health, but that product's in development. So that was, Polari Group, Henry Bless and Anna Varbanova, amazingly talented individuals in London. Another one that we currently have an NIH grant for is Lumina Medical, and this one we're developing a product for anal fissures. And so again, the founder Benjamin Jaywall reached out to me through LinkedIn after seeing like these are the things that I talk about. Like we talk a lot about anal fissures, hemorrhoids. Literally, I work for Hemorrhoid Centers of America, and so he wanted me to see if I would be interested in helping him develop a product. And so we wrote the initial protocols along with Marco Zaccali over at NYU, and that's a product that we're developing for anal fissures, like a medical device. So a little bit different. One is kind of like, retail, kind of over the counter for the A-ball, and Lumina is going to be a medical device. And then the third company that I'm now working with is Bummed. So Bummed founders Rebecca and Jenny reached out to me through LinkedIn as well, and they'll tell you the story that they kind of like stalked me for a while, read all my blogs and read all my social media and stuff, and decided I would be the right person to help them launch a digital anal rectal health company, where essentially we can provide access to like people all over the country where there's not as good, colorectal surgery access, or even like very specific proctology access. We can provide, over the counter or prescription medications via a telehealth platform. And that's launching in the fall. So I guess a really big thanks to LinkedIn for linking me up to all these opportunities. But I have to say,
that's what it's supposed to do, right? I mean, that's the whole purpose. And it really has helped to bring, as opposed to other areas of social media, we have nothing to do with LinkedIn, and it's not a a paid plug, but it's had tremendous impact on my career and entrepreneurial pursuits as well, because it brings professionals with similar backgrounds together. It's great.
Exactly. Yeah, like-minded individuals. So it's been interesting. And I think that juggling a clinical practice and all these, side gigs has been a little crazy, and having like two small children at home. Some days I'm up till like midnight doing everything after, my clinic day and then parenting. And then, the last few hours of the day, I'm like writing research proposals and protocols and following up on emails and meetings and things like that. But in the end, it's all worth it because I think it just gets a lot more of what I'm passionate about out there.
Yeah. And, you touched on a few things that I think are great and they resonate with me. And I think for, there may be patients out there listening. I don't know exactly who listens, but certainly part of our target audience is our colleagues, physicians, nurses, practitioners of all kind, therapists who have training, knowledge, and expertise who are looking to expand on that. And as we said, touch more lives. And it brings me to an interesting connection. I, through this same world, I came to know guys who've become quite good friends now, Dr. Brad Weening and Dr. Paul Zalzal up in Toronto, who have a terrific YouTube channel called Talking with Docs. And I did an episode with them on hemorrhoids, and we talked a little bit about micronized purified flavonoid fraction, H formula, and all of that. And it's had an amazing response. But the point I wanted to make was when I sat down with the guys up in Toronto and I said, you guys are really way ahead of the game here. You have an amazing channel. They have 1 million subscribers and millions of views on individual videos. How did you start this so early? And what you said, Dr. Fong, is what they said, which was, you said before, I was answering 20, 30 questions a day about anorectal health, for example.
Right.
And so they, as orthopedic surgeons, we do things like, I'm a vein specialist. I see varicose veins all day. So people ask the same questions and you kind of feel like that doll, right? That somebody pulls a string in your back and you repeat the same thing. And you wish, oh my God, I wish somebody could just record this and say it for me.
Yes,
well, they started to make videos for their patients, just for their patients to answer the most common questions. And so that kind of led them to videography, recording, and then that got them into the world of a YouTube channel. Whereas your take was, let me write a book about this. I say this over and over and over. Let me write about Constipation Nation. And then the other thing that I think is so interesting is that when I did the hemorrhoid video on Talking with Docs, that's got 160,000 views now or something, which is fantastic because we're reaching a lot of people and educating.
It's amazing. Yeah.
A lot of people in the comments wanted to know about hemorrhoidal health and anal sex. Yeah. And I'm a board certified general surgeon. Of course, I've been practicing vascular surgery for many years. Right. And the docs who host the show are orthopedic surgeons. And to be very frank, we didn't really know how to handle those questions, how to answer them appropriately, professionally, and with expertise. And so we sort of said, it's a little bit outside the scope of this discussion. But it's so interesting that that's something that one of your entrepreneurial endeavors is particularly focused on.
Here's the person who can answer them. So
exactly.
Just those questions. And it's really weird to me that this has become my life, honestly. I did not anticipate this at all. I always joke that my parents wanted me to be a plastic surgeon or a dermatologist, and somehow I'm like, butts and guts all day long.
That's okay. That's okay. It's very important.
Even my kids like, oh, mommy's a butt doctor. I'm like, yeah, I guess that's what I am.
That's okay. That's all right. My father was a gynecologist, so how did I answer those questions as a child? I just said, outside the scope of this discussion.
Yes.
Right, in the second grade. So, but it's amazing how when you start to have these conversations with our colleagues, how there are these overlapping causalities, which is generally that I've got all this knowledge and I worked, as you said, 12 years, right? I always tell people after the 12th grade of high school, after 12th grade, I did another 15 years of training to become a cardiovascular surgeon. And that was kind of a shortcut, that was the direct route. But that's a lot of learning and that's a lot of knowledge. And so we spend a lot of time speaking to people in our community
Yes.
one-on-one. But
Yes.
it's nice now that we have platforms where
Yes.
we can reach many people and affect many lives, and then have these conversations with one another. And
Yeah.
we use your book, your platform, Talking with Docs, my platform, so that we can share this knowledge. So, for example, we can better
Yeah.
serve patients who have questions that
Right.
they might not feel comfortable asking their doctor directly
Right.
or whatever.
Right. Exactly. No, and that's exactly it. That's why I love what you're doing. Like we really need to talk to people outside our specialty more so we can learn more from each other. I'll tell you one of the other things that I've recently been doing is that because my practice is so outpatient based, I rarely go into the hospital anymore or in the OR for like overnight cases, which is good for me, for my
Yeah,
lifestyle right now.
I know the
Um,
feeling, right?
yeah,
Yeah.
I'm like really pushing the envelope as to what I can do in the office that, is better outcomes for patients. So like I'm such a surgeon. I'm like cut everything if I can, but most people don't want that. They want day surgery. They want to be able to go home, like less time off work, like less pain. And one of the things I've been dealing with a lot is fecal incontinence. So like the opposite of constipation. So I've been working with a couple people that kind of pointed me in a strange direction. So I went via like this like sacral neuromodulation and then to anal manometry. But through all these reps who passed me from rep to rep because they were like, oh, how about this? How about this? Finally came across a device called Eclipse, which is only known in the OB-GYN world, but it's for fecal incontinence, which is kind of crazy because colorectal surgeons don't use it. Don't know of anyone who does. And so I've been, using this on a few of my older patients who are like, I don't want surgery. I'm on blood thinners, doing things like that so that we kind of, again, pushing the envelope on what we can do better for outpatients, like, or for our patients as outpatients.
Amazing. So
Yeah.
tell us a little bit about your involvement with, because this is interesting to some of us. We recently had on the program another person who's become a dear friend, Dr. Sanjeev
Mm-hmm.
Lakampal, who started
Mm-hmm.
Center for Vein Restoration, where they
Okay.
now have about 115 centers. And Sanjeev, like myself, was a cardiac surgeon, practicing cardiac surgeon for about 20 years, and then got involved in veins, and then
Right.
found a way of scaling it to reach more people. And
Right.
I think they have about 90 doctors, 115 centers. So tell us about Hemorrhoid Centers of America and how
Yeah.
that started, and the growth of that, and where you see those kinds of projects going.
Yeah, no, that's a great question. So Hemorrhoid Centers of America, my partner, Dr. Alan Goldman, was the founder of it. And there's actually a long kind of like tortuous history of like how he got to hemorrhoid banding, because he is also a board certified trained general surgeon who also did trauma surgery for 30 years and then decided to do mostly hemorrhoids and office proctology for the last, I think it's 15 or 16. I was actually very lucky to join him a few years ago now. And become like the co-medical director. We have 13 centers in the entire US. And right just now, last 2 weeks ago, we opened our 6th office in the Atlanta area. So we have a ton of expansion happening and hopefully trying to add another provider soon, and another office hopefully in the Southeast, like Southwest area. So that part, I make the joke that I'm like the only person in the company who didn't marry into it. Like, a lot of his children actually work for the company and do a lot of the practice administration, marketing, IT, for example. But one of the ways that we've been, trying to expand is like not only are we offering this product of the bander as it's not really a franchise, but we offer the bander to our other offices and make the purchase orders and stuff like that. Trying to expand these products into the other offices as well. So H formula and cleanse, which is like for pruritus ani, so treating very common conditions, or like fiber supplements, for example, that we try to get placed in all the offices. And really the process itself is relatively simple. We're like, hey, we recommend this. Do y'all want to do this? And then they do, because we've proven at our like flagship headquarters that it works.
Yeah, it's great. It's
Yeah.
great. And then you roll that out, and then
Yep.
the reason, and you touched on it perfectly, As you know, my father was a doctor, he was a
Yep.
gynecologist, and
Yep.
the reason that I called the show The Business of Better is
Yeah.
because first and foremost, in ethical, medically related business, the
Hmm.
patient still has to come first,
Yeah.
always. And
100%.
the motivation has to be to provide better care, more
Hmm.
comprehensive care,
Hmm.
more holistic care, and whenever possible, more minimally invasive, less
Yep.
painful, more ambulatory, and all of those things that we saw. Again, there's a lot of synergy in our careers because we
Yeah.
both had kind of the big time open surgical training and so forth.
Right.
And um, I went from doing open heart to doing the office-based venous
Hmm.
insufficiency varicose vein work, and you went
Right.
from doing,
An
big
open
total
Hartman's.
colectomies
Yeah.
and yeah, open Hartmans, right?
Yeah.
Exactly, and abdominal peritoneal resections
Yeah.
and big
Yeah.
time cancer surgeries to hemorrhoidal surgery and
Yeah.
anorectal disease,
Yeah.
fissures, et cetera, all of the associated things. But don't you find that these areas are being developed now because for so many years, I think the big time surgeons, the blood and guts people were dismissing a lot of these people. I mean, so
Yeah.
many people for many years with varicose veins weren't getting operated on because they were doing the old stripping procedure in the
Yes.
hospital under general
Yes.
anesthesia. The operation was in many ways worse than the disease.
Yes.
And even by the time I came through general surgical training, I mean, it was just hemorrhoids were so easily dismissed
Yeah.
in the clinic as, sitz baths and Metamucil,
Yep.
whatever. And nobody really wanted to treat them. So
Correct.
when you take an interest in these things, which really cause people a lot of pain and suffering,
Yeah.
have a
Yeah.
massive impact on quality of life,
Yeah.
there's a huge number of people looking for help.
No, I'm so glad you said that because I think that's exactly it. And, I would say that I love doing the big surgeries, and some days I miss it. Some nights I dream about it. But for the most part, even when I was in training and when I was a young attending, people would be like, oh, but this isn't a colon case. This isn't a rectal cancer case. It's hemorrhoids. So go home, take a sitz bath. Or the only solution would be like an excisional hemorrhoidectomy, which is, cut everything out, and people would still have that 8 to 12% chance of recurrence, and it would be like 8 weeks of pain. And so now that I've done this for, quite a while, it's amazing. My partner told me this story at the very beginning of when I first joined on, and he said, he used to scoop people up off of the, sidewalk and bring them into trauma surgery and save their lives. But he has never had people as grateful for him as when he's
Exactly.
like banded their hemorrhoids or treated their fissure, because these are things that people kind of like literally sit on and suffer in silence, and they're embarrassed to talk about. And when they finally come and find somebody who can bring them relief, they're so much more grateful. He says one of his old mentors has like a closet full of whiskey from his patients, something you would never see in a trauma surgeon's office.
Right. Well,
I saw,
I think
yeah,
Yeah, I think that's why something like Hemorrhoid Centers of America is such a great concept and
yeah,
why you're having so much success in rolling it out with 13 centers and
hmm,
6 centers just in the Atlanta area is
hmm,
because when you focus on something like I do, let's say in the
yeah,
vein world, and we have, vein clinics and so forth where they're specialized, the patients feel very comfortable there too because they're getting specialized care by
specialized care,
somebody who's doing that each and every day, day in and day out.
day in,
And
day
the
out,
days of
correct.
the generalist,
Yeah,
you and I both went through general surgery, which is great
right,
training.
yeah,
But patients come to my office, they're not looking for a good ophthalmologist anymore. They want a good
right,
cataract person, a good
right,
retina person, right?
yes,
And retina
that's true.
specialist or whatever. And so it's the world of subspecialization.
Yeah,
And it's a big country with more than 300 million people.
hmm,
And what are the statistics, Dr. Fong? Maybe 50% of people over the age 50 will have hemorrhoids at some point, something like
yes,
that.
exactly. 50% of people and like 75% of pregnant women. So,
So
and
it's a
then,
huge
yep,
number of people.
one
And it
in
can be
three
really
people.
painful.
Yep, really painful, and once it's like pain and bleeding, and then you also have like the fissures that complicate it, then people are suffering a lot. I always tell everybody though that the one other good thing about destigmatizing this like proctology and gut and butt health though, is that when people have pain and bleeding, they're eventually going to be less hesitant to seek help, because I have tons of cases like that I can count, on both hands and my toes, where patients kind of just sat on it for like a year, were afraid to have someone look at it, and it turned out to be cancer, like anal cancer.
Oh
Like
yeah.
somebody would dismiss it and say, hey, it's a hemorrhoid, put preparation H on it, without having really looked at it or examined it. And so once people are more aware that these things can happen, they will seek attention for, their butt problems, and, these things will be diagnosed earlier.
Yeah, absolutely. And that's why the purpose of today's discussion is very much entrepreneurship and business related. But Dr. Fong, for anybody listening who's interested, is definitely going to be my guest also on the Dr. John Chuback channel on YouTube, where we're going to take a very, very deep dive into everything related to these subjects of anorectal disease, hemorrhoids. We're going to answer some of those questions that, or
Yeah.
may be embarrassing or difficult for some people to ask their doctor directly. We're gonna take all that stuff head on, and the fissures and anal cancers and all of those subjects from a clinical point of view. When she comes up, we're gonna sit down together in my office in the studio when she comes to New York to visit, and that's going to be wonderful. But for the purpose of today's discussion, let's focus back in on some advice, do's and don'ts, things you've learned, pitfalls. I just want you to freeform it. You take the floor, because you're a great thinker and you're a great speaker. For our colleagues, whether they're MDs, nurses, et cetera, they could be in any form of healthcare, therapists, beginning career, middle career, later in career. How should they feel about entrepreneurship? What are the pluses and minuses? How do you balance it? I mean, just kind of go from the top of your head.
Yeah, I would say it's totally doable. And I would say that if it's something you're even thinking about, start reaching out, soon. People will be like, no, I have to wait. I have to wait until I develop a platform. I have to wait until I have like, X number of followers on social media before people will send me free stuff. I also thought that way when I was starting out, and I was like, oh, I need 10,000 followers before anybody will listen to me. But I kind of like poo-pooed it, pun intended. And, kind of just went with my gut and said, oh, also pun intended. Went with my gut and said, okay, well, I'm just going to keep doing these things and see what happens. And one of the things my wife always says and jokes about is like, Carmen, you really have like, you don't have a degree in any of these things. And yet you're just like, I'm going to go and do it. I'm going to go write a book. I'm going to go start a company. And the only degree you have is a medical degree. And I'm like, but isn't that enough? Like
It's a good one.
Yeah, it's a pretty good one. Like we learned so much stuff in our medical training. I'm just trying to get that education out there. So what I'm saying is you don't need to have the platform, just start reaching out. And the way I did it was at conferences and stuff. And I didn't even realize I was doing it at first, but things that interested me, right? I would go up and talk to the reps and say, how do you, what's this device do? How do you do this? That's kind of how I got hooked up with Neo Laser, which is a company that produces like a 1470 nanometer laser that I use for fistulas and pilonidal cysts. And so again, bringing a big, whopping outpatient, surgery into a procedure that I could do in 10 minutes in the office with like pretty good outcomes. Fistulas, so far we have no recurrences, and pilonidals, it's about like a 80%, success rate. But I went and talked to the rep. I said, what does this do? Can I try it? They send me, a 2-3 months trial, and we try it. And I'm also very big into research. I know that I'm not with an academic institution right now. That is one of the things I miss about not being an academic surgeon, but I've started doing a lot of my research on the side, again, tracking, for example, how H formula is working for patients, like pre and post outcomes. I've tracked how Cleanse has worked for patients. I've been tracking how this laser procedure is working for patients. And actually most recently, I'm also working on an electroshock device for chronic pelvic pain. So it's just these things, like things that interest me. I go ask them about it. They send it to me, like try it for free for a few months. I track it, make sure it works for us. And then if it works for us, then I can start, talking about it, promoting it. Only Neolaser has so far paid me to promote any of these things, and I did a webinar, I did a talk for them at ASCRS last year. But the rest of them, they're probably coming around. Another one that reached out to me when they found me on social media was the Consul, or the Sitzmark study. So that's a radiopaque capsule that you take for chronic constipation. They saw me talking about it in one of my videos, and it is, I think it's in I want to say it's in chapter 20 of my book, How to Diagnose Chronic Constipation. And so they reached out to me to see if I would do a couple videos for them. Yeah, like that's how it goes. It kind of grows organically, but you just have to keep throwing your net out there.
Yeah, that's so true. And what I tell our colleagues and people who, reach out to me for advice and how to get going with these things is that it's very different than what we're accustomed to as doctors, especially because with medicine and training in medicine and surgery, although it's very difficult, it's strenuous, and requires tremendous amount of hard work and commitment and so forth, there's a very, very well-defined road. Right. It's not an accident how you become a colorectal surgeon versus a cardiac surgeon versus a plastic surgeon. In our day, in our generation, it's changed a little bit since, but we knew that you had to go to medical school, you had to go through general surgery if you wanted to be a colorectal surgeon, a cardiac surgeon, a vascular surgeon, a plastic surgeon. Now there's some shortened tracks and things, but even so, even now it's well defined what you would have to do. You don't just kind of go out and figure it out yourself. Whereas in entrepreneurship, part of the challenge is there is no well-defined, well-beaten path. And that's part of the reason I wanted to make this program, to help our colleagues understand that. And maybe we could start to create that path for them a little bit in having these discussions. But what resonated with me that you said, Carmen, was this business of, your wife saying, Carmen, kind of who are you really to write this book? And I wrote a book on spine exposure years ago.
Right, I saw that.
You saw that book?
Yeah.
And because it wasn't something we did in training, because it wasn't like a major case. So the residents, you couldn't use it for any of your numbers toward anything.
Right.
So we didn't really do them. But it can be a very lucrative and very rewarding part of surgical practice if you work with orthopedic surgeons, spine surgeons, neurosurgeons to do those exposures. So I wrote the book based on my personal experience and my understanding of the anatomy and my approaches that I learned through trial and error. And somebody once said to me, well, who are you to write the book? And I said, well, now I'm the guy who wrote the book on the subject.
Exactly.
So that's what gives me the authority. I did it, right? So there was no such book before. So now my authority is I'm the one who actually wrote the book. I took the initiative to do that. But what's so amazing, and this is what I want to bring across to our listeners today and throughout this program, what I keep saying again and again is we live in a golden age. Mankind has been waiting for thousands of years for a time like this to arrive. And what I mean by that is you don't need anybody's permission. You don't need anybody's validation. In other words, if you want to be a surgeon, you need permission and validation. You need to be licensed. You need to be board certified. You need to have privileges. But so many things in entrepreneurship don't require those kinds of official documentation and so forth. It's just a matter of going out and having the courage to do it. So today, if you want to write a book, not only can you write the book, but you don't necessarily need a literary agent. You don't necessarily need a publisher, right? Through Amazon now, we talked about how great LinkedIn is. Through Amazon, you could do Amazon print on demand, where even when I started writing books years ago, I had to spend a couple $1,000s actually, even if I wanted to self-publish it, having that book physically printed and keep them in my office. And if somebody ordered one, we'd mail them out. Now, you don't even need to do that. Amazon will print and ship the book for you. So we live in a golden age. We live in a golden age. If you want to have a television show, if you want to have a podcast, you're welcome to have one. You don't need NBC or CBS or anybody else. Like in the old days, you and I were, young surgeons watching, right? Dr. Oz got a TV show. Like, oh, how could I get a TV show? Well, it's great that Dr. Oz has a TV show and I don't, or Dr. Phil or whatever, and I don't pretend to compete with them in terms of their notoriety, but We can have our own TV show. It may not be on network TV or cable TV,
Right.
but
Right.
there's
Yeah.
another platform called the
Yeah.
internet, called YouTube, et
Exactly.
cetera.
Yeah.
So where we were always looking for, and this is kind of a hang up that doctors specifically have,
Yeah.
whereas other business people and entrepreneurs may not have this hang up. We were always looking for validation from some governing body, from our professor, from the board of medical examiners, from the state medical society, et cetera, and of course, board certification in general surgery, colorectal. But when it comes to entrepreneurship, as long as you're not breaking any laws, obviously, you could go open a tire shop if you wanted. You could buy a gas station. You could buy a Subway sandwich shop. So we just have to believe in ourselves that if we were able to do all these other amazing things, we can also be involved in business with the intention of serving and helping more people.
Yep, 100%. And I'm so glad. I was just going to say, if you want to be an entrepreneur, you really do. I think you do best if you don't really require that external validation, right? Not to say that if you did require it, you wouldn't do well at it, but it's just something where it's like the Wild West, and we're on the Oregon Trail, and you have to forge your own path sometimes. And there's no predefined path that was like, hey, Carmen, you have to go to a liberal arts college, go to medical school, and then go do your training, and then afterwards be like, oh, go from academic surgery to private surgery, and then be like an entrepreneur and start a bunch of like side hustles. There was definitely no blueprint for that. But I think that's the fun of it. That's like the part where, creative people like you and I want to do something different and want to explore a little bit and what else we can do to make the world a better place and keep it interesting for ourselves too. Like that part I think is huge.
Yeah, and I think that there is that. We do have that in common, that artistic background. And I think that there's a very important part that is about self-expression. And I think surgeons in general probably have some of that because you are expressing yourself through your hands, through your work, and so forth. Certainly you could see plastic surgeons, dermatologists, people who are doing that kind of work have that tendency. But I think to express what it is that's important to you, what drives you, what kind of turns you on is key. Like you said, you're involved in things that are interesting to you, and so am I. And things that, my old chairman, Charlie Sills, he used to love when the medical students who were applying for the surgical program, he said, why do you want to be a surgeon? If they said they thought operating was fun, he loved that answer. It's certainly not a game, but great surgeons do think, surgery is fun. It should be beautiful. It should look nice. It should be pristine, right? Nobody wants to be a sloppy surgeon. Nobody wants to be miserable in the operating room. Nobody wants to be anxious in the operating room. If you don't get some degree of pleasure from it, you shouldn't be a surgeon. Same with entrepreneurship. It's certainly not just about making money. And as you said yourself, it's not like money comes pouring in right away. If you don't enjoy the process, if you're not having fun with it, if you don't find it interesting, it's probably not for you.
Yeah. And I mean, I think I'm huge on ideas. And again, having that art background and a little bit of a writing background, like I think ideas are so important, right? And people kind of neglect that, in your day-to-day life, you're not thinking about the big ideas and the big picture, but getting these ideas out there, that's part of what being an entrepreneur is. Like nobody's thought of doing like a digital health platform for anorectal disease, but that's a big idea. And it's, they always say that like great artists will kind of paint the same thing over and over again until they get it right, like in a myriad different ways. And, I think being an entrepreneur is kind of like that. You're kind of trying all these different things until you're like, okay, well, this is what sticks.
Yeah, and I think that's a really good jumping off point for a lot of our colleagues who said, well, how do I get started? And, I give a lecture on this. I gave it down at the American Venous Forum. I'm going to be giving it again at the VEITH meeting in New York. Lowell Kabnick asked me to give it again at VEITH. And I bifurcate the process for entrepreneurship for physicians. One is a clinical medicine way, which is what we've been talking about mostly today. The other was what I mentioned before. You're allowed also, if you've made some money and you have some time and interest, you can buy a bunch of Subway, start with one, obviously, but Subway sandwich shops or McDonald's or whatever it is, entrepreneurship outside of medicine and
Yes.
clinical practice.
Yes.
That's
Yeah.
another way to express yourself if that's what
Yeah.
you have interest in. Let's say somebody like me or you, we might want to own an art gallery one day
Yep.
because we have an interest, right?
That would be
So,
awesome.
yeah, so follow your interests, follow your passions.
Follow your passion.
But from the clinical point of view, what I was going to say, and Carmen, it seems that this has been a big instigator for you. I know it was for me with Vita Support MD and H Formula, Vein Formula, the others, is you're always asking yourself, is there something more that I could do, or is there a better way of doing this? Could we make this? And when you and I look at our training, because we're pretty relatively from the same vintage as far as I know, I mean, we've seen things that were only done in the hospital under general anesthesia and on a rare basis because they were morbid procedures, now being done on a large scale in an ambulatory setting under local anesthesia because somebody kept saying, isn't there a better way we could do this? Isn't there a less invasive way, less painful way? And I think that's a great place for our colleagues to start by asking themselves when they're practicing every day, is there something I could do to make this better or easier and less traumatic for the patient, et cetera?
Exactly. Because I was just talking to someone the other day who was saying, we do same day colectomies now, right? We went from staying 2 months, for when people first started having rectolectomies, staying 2 months in the hospital to like a week to like 3 or 4 days. And now we're doing same day colectomies. Same thing with hemorrhoids. People would be, in the hospital for months and months and months, with an open wound. And now we're down to, okay, we're going to do it in an ambulatory setting. And so when I tell people I just do it in the office under local, they're like, what? Like,
it's amazing.
People don't want to be in the hospital for these things.
And you have to question, you have to always question, because we have so much respect in our training, generally speaking. There are exceptions, but generally speaking, tremendous respect for our elders, for the people who came before us, our professors, even our senior residents and chief residents and everything. Like when you're a first year, you look at a third year or fifth year like a god, like, wow, this guy is really smart, or she's really brilliant, or look at her, wow, she's tying knots with one hand with her left hand. Like you can't, right? So we don't like to. We're not trained to really question our elders and what came before. So it's very difficult to say. My father had some friends over one day when they were very elderly who were ophthalmologists. And they were talking about the days where for a cataract operation, you were admitted to the hospital the day before, right? The intern would take the history and physical, draw blood, get a chest x-ray, and they would give you an enema the night before surgery because
I've heard that.
every single patient who went to the OR got an enema because they were worried about whatever, I don't know, ileus or vomiting or who knows what. But every patient who went to the OR got an enema. The cataract was done under general anesthesia, and when they came out, they were on a bedboard with what do you call them? Sandbags on either side of the head. The head strapped, no movement, and people were dying of pulmonary embolisms after being in bed for a week. And now you go and they don't even dilate the eye anymore. They don't even give you drops.
No.
It's because somebody kept asking, is this really necessary? I mean, I know this is the way Dr. So-and-so's always done it, quote unquote, but could we do it a different way? So I think that's important.
I think that questioning and that curiosity is it. And I agree. Like we're not like questioning the attendings. We're just like kind of building upon what we already know. Right. But the curiosity, there's always a good way to, better way to do something. And, there's more than one way to skin a cat, and there's always a better way to do something. And at the risk sometimes of, I don't want to be like a snake oil salesman where like I'm like going around being like, touting these like unproven things. But I think there's just so much that we don't know that there's always, better ways. Yeah.
And believe me, nobody knows that process better than me, having brought dietary supplements to the market. And the very first, and I understand it. So the good thing, the advantage I had was I was a doctor. If I were a salesman or a business person, I might have been confused what's going on here. But I knew that I understood when I brought dietary supplement to the marketplace for doctors to use with their patients, that there would be an immediate pushback, which was the old thinking, which is dietary supplements don't work.
Don't work.
Right?
Yeah,
You're just pissing your money down the drain. I mean, excuse my French, but that's what we were taught, right? That they just don't work. And then I had to, like I did with you and so many others, based on a lot of the education and training I got from my dear friend and colleague, Monica Glavitsky, spent innumerable hours, thousands of hours in the last 10 years, speaking to doctors about all the research, the science, the clinical studies, the doubly blind, randomized control studies, et cetera, that you have to re-educate our colleagues. So my point in that, outside of, my experience at VitaSport MD, but for any listeners out there, if you have a great new, even if it's a great new idea, don't be surprised, and I would even venture to say expect to get a lot of pushback, because physicians don't like anything new. They don't 100%. Like change because it's disruptive.
Yeah. Well, and it's I think, and something kind of funny, because I always say, if you've gone through medical school or run a marathon, you can basically do anything. And I've done both at this point. So
I've done one and I'll never do the other.
I love the joke. How do you know if someone's run a marathon? They'll tell you. Right.
They have the bumper sticker to prove it.
Yeah, they have the bumper sticker. But it's just like surgeons have like, sometimes can be superstitious, right? And I think it's like, they tend to be set in their ways, because when things work, they keep doing things that way. And so especially, I think, in our field, like more so than even in like internal medicine, but like surgery in particular, people are set in their ways, and introducing new things is hard. And so we need the data. And that's why I keep track of everything, because surgeons love data and they love publications and they love research. So if you have the data to support it, it's always a good thing.
Yeah, that's really smart. And, that's one of the things that we started hearing more about when you and I were younger, was this, at the time, it was kind of a new concept. I mean, at least the verbiage or surrounding it, this idea of evidence-based medicine, evidence-based medicine, evidence-based medicine. And I think that makes a tremendous amount of sense. So one of the things that, I respected about you very much, and there have only been a handful of people who did that, but there have been a handful over the years, over 10 years, that said, hey, look, I get it. I believe in it. I see all the data you're showing me. I see all these studies, but I'd like to take it and try it in my own patient population and do my own little pilot study, or, and see so that's an amazing, amazing initiative that you took. And I think it's great advice to our listeners in entrepreneurship. If you have a great idea and you don't have the data based on the scientific literature, well, put a little time and work into generating some of that data, even if it's, a pilot study with 10 or 20 patients.
Exactly.
At least you have that to bring to somebody. And then, as you like to do, Carmen, and I know we've talked about this, then see if you could make a poster for a meeting. See if you could do a presentation at a meeting, see if you get it written up in a journal, because that adds a lot of credibility.
No, for sure. And it doesn't, like you said, it doesn't have to be a huge study. It doesn't have to be randomized controlled, but, just start collecting that database, and maybe eventually it will turn into something. Who knows? Yeah.
Well, you catch other people's eyes too, right? If you put it out as, let's say, a pilot study. I worked with a guy, Shlomo Gabe, when I was in medical school doing cardiac surgical research. And Dr. Gabe was a brilliant man, and he was big on pilot studies. He was like, let's just look at 10 patients and then submit it and see if we can get it published. And it worked very frequently, and you called it a pilot study. You didn't try to make it look like a randomized control thing that was going to, be the be all and end all on the subject. But then what would happen was other physicians from around the country would invariably reach out to him. This is before LinkedIn, and say, hey, Shlomo, I saw your pilot study, and, I've been thinking the same thing. Why don't we call Tom Jeffries or whatever? And between the 3 institutions in New Jersey, Chicago, we could do a study with 100 patients.
Exactly.
So you get the ball rolling.
Yeah, it's like, I'm talking about ideas. It's just getting those ideas out there, and then, and then in 10 years when they do a randomized controlled trial, they'll be referencing your pilot study, right?
Yeah, and it's funny. I think, Carmen, you actually have my book of poetry. You're
Yeah.
one of the three people in America who was interested in having it and reading it, but that's okay. It didn't stop me from writing it. But people say, wow, how did you write an entire book of poems? And the answer is one at a time,
Yeah.
right?
Right, exactly.
It's like and the logo for Chuback Education is an elephant with a bite taken out of its backside, because one of my favorite, aphorisms is, how do you eat an elephant? One bite at a time.
Yeah.
When you want to take on a big project, whether it's writing a book,
Yeah.
like you did, and it's going to be, let's say 30 chapters. Well, let's start with chapter 1, or let's start with the introduction, or let's start with an outline, right?
Right. Exactly.
So just get started, I think, is the best advice we can give to our colleagues. Just get started, do something, take the first step.
Yeah.
The difficult part is that's easier with what we're accustomed to, because if you get to the first year of surgical training and you just do your job, you'll get through the 5 years. They're well defined for you.
Right.
Here you have to kind of go at it with a machete. You're kind of clearing the path in front of you and forging that path as you go, because it isn't well trodden, because you're doing something entrepreneurial, which is something new.
By definition. Yeah. And I think there's just like so much for your listeners to digest here, and like all these good points that you've brought up, that it's kind of cool. I love talking to you, because I do think we have this like synergy.
Yeah, well, that's why I wanted to have
fun.
you on the show, and I can't wait to have you on the Dr. John Chuback channel. Now, we're wrapping up here. Wow, we're over 50 minutes already.
I know.
So let's wrap, and let's talk to our listeners about how they could get in touch with you, and just give us a brief synopsis, again, a rundown of all these amazing projects you're involved in.
Whew, okay. All right. So getting in touch with me, www.carmenfong.com. That's actually the easiest way. My email is on there. But I'm also on most forms of social media, most active on TikTok and Instagram. I am also on Facebook as Dr. Carmen Fong. And I have a Substack with 3 different blogs right now. So one is kind of a personal monthly blog. The second one is In My Medical Opinion, which is me commenting on other things that are happening in the medical world. But the third one is a weekly. It's called the Weekly Digestive, a pun on digest. And that's about all the gut and butt health things. So those 3 are really good ways to find me. Other than that, you can come visit me in Atlanta. So all the things that I'm working on. I'm the co-medical director of Hemorrhoid Centers of America. I'm the chief medical officer of BUM.
Let me just stop you right there. So Hemorrhoid Centers of America, if there's a doctor out there who's interested in getting involved and maybe opening the next Hemorrhoid Center of America in his or her community, is that a possibility?
Yes, please reach out. I actually am speaking to someone next Monday.
Fantastic.
Someone who reached out to me. Yeah.
Okay.
Yep,
Next.
absolutely. Bummed. So the digital telehealth company, chief medical officer. And
now is that bummed.com?
It's actually bummed.co.
Bummed.co. Awesome.
Yep, bum.co. And let's see, for that, I actually have a good board of medical advisors right now, but if you are interested in helping out, I'm looking for more people in the physical therapy, generally like a urogynecologist and people who can advise us. Maybe I could use somebody who's like into vein health and supplements, because we're definitely going to sell H formula on our website.
I don't know anybody like that. Yeah, I would love.
We'll talk.
I would love to have that discussion. Of course, amazing.
We'll
Great.
talk. So there's that, and then also Lumina Medical, which is the Fisher device, and Polari Labs, which is based out of London, is the A-ball. Also, if you're interested in doing lasers, like a neo laser for fistula or pilonidal disease, you can definitely call me and ask me. I actually have another phone call this afternoon with someone who's in Texas, who's interested in doing the laser. I think that's most of the things.
That reminds me of another thing. We had a guest on, Dr. Neil Lonky, Lonky, who's a gynecologist out in San Diego. And Neil owns a company that he started called Histologics. And he has these debridement devices, And when you mentioned before fissures and tracts and sinuses and pilonidals and so forth, I wonder if that might be something that would be of interest to you, which is another reason we do this show, which is to bring people together. Oh, let's talk about your book and how they can find that.
So on Amazon, Constipation Nation, and I think it was actually on sale for the Kindle or the Amazon Prime days. I love it so much what you're doing, because I think that this is totally necessary in our world today, where everybody's just like super subspecialized and like kind of in their own little bubble and not talking to each other, and we really need to be cross-communicating.
Yeah, in fact, my wife and I were talking this morning. We could go on forever, the two of us, but wrap it. Because as you know, Diane has a PhD in neurochemistry. She had an undergrad degree from NYU in psychobiology, and we were even talking about the psychosomatic. And when I say psychosomatic, I don't mean the false connection, but I mean psycho or psyche, the mind, and soma, the body. And as a general surgeon and colorectal surgeon, prior to H2 blockers and proton pump inhibitors and so forth, how many people in the 50s, 60s, and 70s were getting, perforated peptic ulcers and so forth, and the type A personality and, anal retentive person. And when we get to Dr. John Chuback, I want to talk about the endocrinology and this and that, but what about the psychology and the psychobiology of the nervous system and its connection to the GI system? That's huge.
The mind-gut connection is huge these days, right? So we know that the microbiome affects so much of the psyche, like it can contribite to depression and cardiac disease and your skin conditions and your gut, So I think the microbiome is sometimes it.
Well, as you said, Carmen, there's something wonderful about super subspecialization, but the problem with that is then you kind of lose sight of the whole organism, the human being, and how all of these unbelievably sophisticated, intricate, and nuanced biochemical systems are communicating with one another and interacting. That's what, when you talked about endocrinology, she and I were discussing how we loved endocrinology in school. It was one of the most difficult things to study, but by far one of the most fascinating and interesting, right?
For sure. Yeah.
So the different parts of the body, the heart and the backside and the brain, and they're all talking to each other.
It's all related. And so much of like you said, we could go on like this forever. And I could start talking about pelvic floor, but I won't go there because I could babble on about.
But we will talk about that on the other program, because that's in the world of lymphedema and venous insufficiency and so on and so forth. Pelvic floor is becoming an enormously important subject. So, and there's a lot of entrepreneurship going on there as well. So
exactly. And I'm seeing so much of it and doing so much of it. And, again, trialing like the Softway device for chronic pelvic pain, when even Botox injections haven't fixed everything or physical therapy hasn't fixed everything. But then, also like adjusting the microbiome, some of them have, some of these people have like IBS, like IBS-C or IBS-D or IBS mixed. And a lot of that is kind of like, food fear, but also it's microbiome related. Anyway.
Incredible.
Yeah.
Dr. Carmen Fong.
Thank you so much for having me.
I want to thank you for being my guest. And congratulations on all the good work you're doing, because I know it's all patient focused. And I know that you don't get involved in the sale of snake oil, which I really respect. And I look forward to having you on the Dr. John Chuback channel to discuss some of these clinical subjects in depth.
No, thanks so much.
Thanks a million. Thank you all for tuning in, and reach out to us with all your questions, comments, concerns. We'd love to hear from you, and see you in the next episode of The Business of Better.